Chris, how's studying coming?
Oh, I hate finals so much.
I think I need a study break. My brain is just not working right now.
Yeah, I gotcha. I need to keep going.
Alright, I think I'm probably gonna go like mow the lawn or something just for a little bit. And then
Yeah.
I'll come back and finish these timetables.
Alright, sounds good.
Alright, well, see ya.
Yep.
Clostridium tetani is a gram-positive rod-shaped bacteria that is introduced to the body usually through a puncture wound to the skin. The bacteria itself is not what causes the disease, but rather the neurotoxin it produces under anaerobic conditions. More specifically, the clinical manifestations of the disease are observed when the toxin inhibits normal function at the neuromuscular junction. Another prevalent source of the infection is the umbilical stump. The tetani bacteria commonly reside in the soil because it is produced in the gut of many animals, and their excretion leads to contaminated soil. The common misconception about tetanus is that it is due to rusty nails. While that is a potential source of infection, the rust has nothing to do with it. The rusty nails have probably just been on the ground, which was infected, and they often cause puncture wounds.
I was mowing.
It was just fine. Stepped on a nail though, it kind of hurt.
That's too bad.
Yeah, it's not even bleeding though, it's nothing to worry about.
Yeah, that's true. Don't worry about it. Get back to studying.
Alright.
The first symptoms observed in tetanus patients are grinding of the teeth, also called bruxism, and contraction of facial musculature, leading to tetanus's common name, lockjaw. Also rhesus sardonicus, called the sardonic smile, which means a permanent smile. The next symptoms involve a stiff neck, where the patient finds themselves involuntarily looking up due to contractions of musculature in the posterior neck. The tetany then affects the muscles of the throat and respiration, and in the latest stages, the back and legs contract, making an arch back. The final stage is called opisthotonus, where the patient only has their head and heels touching the bed. Their survival rate from this point is 0%. Facial and back muscles are usually affected first because the shortest peripheral nerves are first to deliver the toxin to the CNS.
What's going on? What's happening? Hello there, Josh?
Yeah?
Okay. My name's Dr. Ramy. It's nice to meet you. Being your attending physician. It seems that you came down with a case of tetanus that you might not have known about. The ambulance had to bring you in, and well, thankfully we got you all fixed up in time. But you're going to have to be staying here in the ICU for about 2 weeks, and we won't be letting you see many more visitors other than myself and the attending nurses because it could cause some brain seizures. So you'll just have to be kind of resting here for 2 weeks. We have you on tetanus immune globulin and 16 million units of penicillin to kind of hold down the bacteria that's in you. And we also have you on some Valium to keep away the pain that you've been having. Is there any other questions you have for me at this time?
Yeah, how did this happen?
Well, it's a little complex. You're still waking up here. We have you on a lot of heavy doses of medication, so I'm going to have you sleep for a little bit, and I'll come back in a few hours, and if you've woken up a little bit more, I'll talk to you about it then. How about that?
Alright, yeah, I need some sleep.
Yeah, alright. Well, I'm going to let you get back to sleep there, and I'll come check up on you in a little bit, alright?
Alright, thank you.
Yeah.
The first step to the pathophysiology of tetanus is called absorption, where it's simply introduced to the system. The second step is called binding, where the bacteria finds the neuromuscular junction that we learned about in class and is usually introduced to the peripheral nervous system and binds to ganglioside, a component of the plasma membrane on the nerve synapse. The third step is endocytosis, where upon binding, the cell introduces the tetanus bacteria into the postsynaptic neuron. Fourth is retrograde transmission, where the bacteria moves along the axon against its normal direction of conduction. Its destination is the CNS, and it moves at the rate of 75 to 250 millimeters per day. This process can take 3 to 14 days. Fifth is discharging. From here, the neurotoxin is released from the bacteria. Next comes binding. Once the neurotoxin is bound, it inhibits the release of neurotransmitters. Because this binding can be irreversible, if it's not treated in time, it causes muscles to remain in a rigid state. The neurotransmitters that are affected by the tetanus toxin are called glycine and GABA, and they both normally act as inhibitory neurotransmitters in the central nervous system.
Hi there, doctor.
Oh, hello there, Josh. Okay, so, about how you got tetanus. Do you remember getting any kind of small poke or puncture? I'm not talking about a large cut. Because tetanus bacteria wouldn't have infected you if you got a larger cut or a scrape. Do you remember getting poked anywhere? Just small?
I think I was mowing my lawn like 2 weeks ago. I stepped on something, but I didn't think it was that big of a deal. It just kind of poked me. Would that have done it?
Yeah, actually it probably would have. See, the tetanus bacteria is usually commonly found in the ground, and by having a small poke, it'll actually infect you that way because bacteria is anaerobic. So it would grow by having a small puncture in your foot. So that might have actually done it for you, even though it seemed very simple.
Weird. Yeah, it didn't infect or anything. So.
Over 70% of all cases involve people over the age of 50 years, and the effects have no predilection over gender. The prevalence of tetanus has waned over the last century largely due to the vaccination and access to medical care. Some of the possible complications include pulmonary arrest, cardiac failure, vertebral fractures, and airway obstruction.
Was I supposed to be immunized, or what happened?
Well, actually, by the looks of your records, you haven't been immunized in over 12 years, and you need to get it every 10. So you really need to keep up on your shots, because that would have saved you from being infected.
Alright.
Immunization in early age and booster shots every 10 years or 5 years after a significant injury will prevent someone from contracting tetanus. The immunization shots currently administered prevent both tetanus and diphtheria, but some also account for acellular pertussis. Immunizations have almost completely rid the U.S. of tetanus, but it still remains a risk in some other countries today. In the U.S., there's only been one reported case of tetanus contraction with an up-to-date immunization, and that happened to be my dad.